Yes.
Yes. Brewy is spelled Bruit, but it is pronounced brewy. A brewy is an abnormal sound within a blood vessel. Okay? Remember what a normal vessel sound like? Nothing. They don't make a sound. Because here's why. Because the blood flow down the center is smooth. If, God forbid, somebody has a tumor and it presses on that blood vessel, I mean, it happens all the time. You could save somebody's life by listening to their carotid arteries if they have a tumor growing in here, because it could push on it. And then when the blood flows through it, it would swirl. And when it would swirl, it would sound just like that. Or would sound a lot like taking blood pressure. So when you might wonder, okay, they listen to your heart. Why are they listening to my neck? To see if you have clogged arteries or turbulent blood flow there that could be plaquing or tumor or other things. That's why they listen in other areas. So an abnormal sound in a vessel is called a brewy. It happens because of turbulence, turbulent blood flow. Anything that makes blood flow turbulent in a vessel will create a sound. That's why what we do, squeeze it off, and then the heart pushes hard, that's turbulent, it makes a sound when we check blood pressure, okay? In the heart, an abnormal sound is called a murmur. A murmur. In a blood vessel, an abnormal sound is called a brewy. In the heart, an abnormal sound is called a murmur. We're going to talk about normal sounds in a little bit, and then we'll talk about abnormal. The next thing I want to do is mention blood pressure again. When the left ventricle contracts, what does that do to the aorta? So, to the aorta, when the left ventricle contracts,
It closes the valve.
When the left ventricle contracts, where does blood go?
To the
Up. To the aorta. What does the aorta do? Read pulse. Read pulse from your paper.
Alternating expansion.
What does the aorta do?
Alternating.
Not that word.
Expands.
Expands, right? So let's think back to it. When the ventricle contracts and blood goes up, expands, right? It had to be flexible. If it was a pipe, we push fluids in West Texas through pipes all the time. Does the pipe change size? No. You just pressurize it, more and more and more pressure if it does, right? But the aorta is not like that. You push blood in there, it expands. Yes, the pressure went up to 120, but imagine, what if it was hard and you push blood in there and it didn't expand? The pressure might go to 180 or 200. We'll go higher. So the concept is this. Tissues need to be flexible. They need to have the ability to stretch.
I was thinking atria.
Oh, if it went back, I got
Yeah,
you.
I got
If
it.
it
That's
went,
what I was like. And then when you said
yes, it
aorta
closes the
again,
valve.
when
Now
you
it's
said
making.
it again, I was like, oh, okay, I'm on the wrong part.
That makes
I was
sense.
way off.
Mm.
Sorry.
No, but you were correct for what you were
Yeah,
thinking.
okay, I was
Yeah,
like, wait.
absolutely.
So I was thinking, then when I was still trying to figure it out, and then he said aorta, I'm like, oh, that's where I was all.
The other A. There's so many A's, right? Artery, aorta, atria.
Atria, that's like.
Yep.
No.
And so the fancy word that means the ability of any tissue to stretch is compliance. Compliance. We want tissues to have high compliance or good compliance, right? If they lose their compliance, it means they're not flexible. So we want them to have good compliance. Name a tissue that needs to be able to expand when air moves into it. The lungs. Yeah, maybe I should have said organ, but that's what I was looking for. Your lungs need to expand. Wow, imagine if your lungs hardened. That could be a problem, right? There's some lung diseases where the lungs actually harden. They become fibrotic. And they don't expand well, and you don't breathe well, and you don't oxygenate well, and it's a problem. It's a big problem. So it's not just, I want you to understand what we're about to do. It's not just arteries that have compliance issues. Tissues in the body can have compliance issues. All tissues need to have their own amount of compliance or ability to stretch. So the next thing is we'll look at two conditions that impact arteries. The first one, I'm going to go out of order. Arteriosclerosis. Hey, look, there it is. What's this across here? Right, that's a lumen, not a nucleus. Very good. That is a lumen. That is an artery. Arteriosclerosis means hardening of the artery. When an artery is hardened, that doesn't impact its size. Its tissues just got harder. But now this hard artery is going to act like a pipe. And it doesn't stretch as well. Depends how hard it is. Maybe so hard it doesn't stretch at all. And so it's very important that you understand. The lumen's still the normal size. But when the ventricle contracts and pushes blood in here, it won't stretch. So here's what happens. People that have this disorder usually have a high systolic pressure. Don't worry, I'm going to fix that lumen. Atherosclerosis is also an artery. And this time this happens. In the tissue, we start to get plaquing. And it impedes the lumen. It actually takes the tunica and it moves it. So there's commonly still a tunica there. But we build up a plaque in there. So now the lumen is smaller. Because the lumen is smaller, when the normal blood is in there at rest, it's higher pressure. So patients that have this will commonly present with a higher. Now, please note, I'm being simplistic here. They don't necessarily have to impact it exactly like that. Certainly that plaque could be hard, that artery could have hardening too. They could both go up. It's not always either or, sometimes it's both. Notice they're both called sclerotic or sclerosis. But I like to give you a first line of understanding, and that's what I'm doing here. So on my test, when I ask you this, I will ask you maybe to define each one. This is how easy it is. Arteriosclerosis, hardening of the arteries. Atherosclerosis, a plaque within an artery. Let me write that. That plaque might be fat, it might be calcific, it might be both. Plaques vary.
So what is athero?
So athero, I don't remember literally what it means, but it has to do with some kind of blockage or plaque.
Right.
Yeah. Looky there, it means fatty plaque. Pretty cool how that works. So that's one thing that's so interesting to me is that sometimes the plaques are flexible, real flexible, and sometimes they're not. Sometimes they're like that, but other times, I know I've got a different color. Could leave you with a lumen like that. That's when there's, and imagine this too. Golly. That's going to go down even into the capillary. You could get plaquing even in the capillaries, and then you're not going to get as much oxygen down into those tissues. It could be, woo. And that's real. That lumen now is real easy to block, right? So you get a little clot, a little tiny, almost invisible clot could block that, compared to what it would take to block this. So not good, not good. So those are two conditions. The other question is, how would each impact blood pressure? Hardening raises the top, the systolic. A plaque where the lumen's small raises the diastolic. Certainly this could do both, but for sure it's going to do the bottom, okay? So your patient that comes in, let me say, I'll call out a blood pressure. You tell me which one they most likely have. 130 over 100.
The plaque.
I'm not putting the units. Please note, we should always put our units. Okay. Yeah, because the bottom number's significantly higher than the top. Look at this. If you've checked blood pressure a lot, you'll see patients like this. Man, that top number's way up there. So they probably don't have a ton of plaquing yet, but the changes are starting to happen that might lead to that. Plus, you're also going to see patients like this. Yee. Or like that. I mean, there's all kinds of variations, right? Remember, a person can have both at the same time. They don't just have to have one or the other. So there, if you didn't get the picture, go ahead and snag it. It's really weird. We get done faster than any other class I've ever taught. We always do. Now, I'm not telling you you're about to get out. We have a lot to do still. But my class yesterday morning, I taught the same thing to, and it was probably, it would have been pushing, we're 20 minutes ahead of them at least.
I'll be right back.
Oh yeah, go ahead. That's okay. So on this handout, look how close we are to being done with the handout. We have to do when valves don't work, what happens to blood flow, and we have to do the heart sounds. Okay? Those are pretty important. I'm going to draw a little picture. Just to remind you guys of something. Hey, what are the top two chambers called? Atria. What are the bottom two chambers? Ventricles. Which ventricle's the thickest? The left. Tell me why. Pumps to the body. Perfect. Pumps to the body. So, these chambers, the atria, their job is to push blood down, to fill up those ventricles. Okay? Now, I want you to know, before they contract, blood is coming in, and look, the valve's pointed this way. So when a fluid would come into a little valve like this, it would simply push it open. So even before they contract, those valves are open and the blood's going down. There's nothing to stop them because the pressure, it doesn't take any pressure to open that valve because it's pointed in that direction. It's just ready to be pushed right open. So blood comes in and moves down, and then they contract and they push it all down. And then we get this. Kind of get blood filling up those chambers. And now the ventricles contract, and what do? They push blood up and out. So watch this. This one sends it this way. Right side pumps to the lungs, right? The right side pumps to the lungs. And the left side pumps where? To the whole body, to the whole body. So notice if I wanted to be fancy, I could throw these colors on there to remind us pulmonary trunk versus aorta, just to give us something to see. So I could come in here and do the red blood, and I could come in here and do the blue blood. Okay? So I just want to remind you, that's how the heart works. Atria contract, push blood, down into the ventricles. Ventricles are relaxed, they receive that blood. Now they contract and push it up and out. The right side pumps to the lungs. The left side pumps to the body. Okay? And all blood that's leaving the heart leaves going up and out. Notice, up, up. Yes, the aorta curves and goes down. There is no hole in the bottom of your heart to let blood go down. Doesn't happen. All blood goes up and out. Okay? That's just a little reminder before we do the next stuff. If you want that picture, you can snag it. That's just a reminder, though. The next thing, I just love talking about this. It's so fun. What sound does a heart make? Well, let me raise my little flaps so I can hear. We have a reader. Okay, are you ready? Something, right? How many sounds do you hear? Two sounds, right? I know some of you already know the answer, so I'm going to walk us there. Remember when we did blood vessels? What did normal blood flow sound like? Nothing. So in the heart, when the blood's moving, the normal flow, no sound. Blood flow in the normal direction makes no sound. The blood's not making the sound. Okay? Oh, by the way, we call it a heartbeat. 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 You were lied to. It ain't no heartbeat. Your whole life you've been lied to. Think about it. When they say heartbeat, you visualize a heart. Don't you see it going? Heartbeat. Heartbeat. No, no, no. Here's why. Heart's muscle. Muscle. Ear. Contract. No. Try it. Make your muscle by your ear. You know what you're going to hear? Your little elbow popping or something. You ain't going to hear no boop, boop going on. Because muscle contraction makes no sound. Blood moving makes no sound. Those people lie to us. They love us, and that's why they lie to us. Listen to my heartbeat. Nope, ain't no heartbeat. But we're still going to call it that. So, here we're going to say the heart sounds. We're going to be more correct and call them the heart sounds. So, if it's not the blood, and if it's not the muscle, what else could it be? Are you ready? Here we go. We're going to do blood flow through the heart one time, just to make sure we remember it. And then we'll come back and do it. These chambers at the top, what are they called? Atria. They contract and push blood down. And that blood's going down and filling up the ventricles, which better be relaxed, right? If they want to receive the blood, they better just be chilling, hanging out, chilling. Now the ventricles can contract and push blood up and out, right? And now after they do that, what do the ventricles do? They go back to relaxed. So do you see that? These little dudes contract, push blood down. Oh, by the way, now they relax. Blood's down there. These things contract, push blood up, out, and now they relax. And so at this moment, everything's relaxed. Wow, that's cool. After every heartbeat, which isn't a heartbeat, everything relaxes for a while. There's a moment where everything's relaxed. Your heart never gets a vacation. It can't take a long-term break, but after every beat, it gets a little rest. So, rest. That's not the sound. Please, I shouldn't even have done that. Okay? So here we go. Here's the sound. Atria, squeeze, no sound. Blood moves, no sound. Valve opens. Listen carefully. Did you hear that? No, because it didn't make a sound. Blood's down there in the bottom. Didn't make a sound. Ventricles contract the muscle. Did it make a sound? No. Blood moves up. Blood making a sound? Here's a valve. The blood hits the valve and does this sound. And then the blood goes up and opens this valve, no sound. And then the blood stops flowing and it pushes against this valve. And that's the second sound. Your heart sounds are the closing of the valves. That's what makes the heart sounds. Okay? I know. Our whole. So here's the thing. When you lay on your husband's chest and you hear that beautiful noise, and now it's going to be even cooler because you know what it is, and you're going to be able to visualize it. You should really do it sometime and think. Valve. That's blood moving, hitting the valve and closing the valve. The blood's not making this, right? The valve closing, it slaps shut and makes a noise. Now, why do we have two sounds? Because we have two types of valves. Two sets of valves. Both AVs close at the same time. That's number one. And then both semilunars close. That's number two. That's what I'm about to show you. We're going to draw all that, okay? So here's the cool. There's a few times in A&P where they do things right. You know what the first heart sound is officially called? S1. Gotta love that. Doesn't get easier than that. I don't even know if it's an abbreviation for sound one or not these days. It's just S1. That's what it is. It's accepted. I used to do lub and dup. I don't really even do that anymore. This is the real name they're going to use. Okay. S1. That's the first heart sound. Oh, so let me put it here. These are the heart sounds. And so sound one is produced when the ventricles contract and push blood up. And before that blood leaves, because we've always been saying up and out, right? On its way up, it hits the AV valves and it closes them. So this noise is heard when the ventricles are contracting and when the blood is flowing, but it's not the ventricles in the blood that make the sound. It is the AV valves, the atrioventricular valves. You might just remember I'm going to color code them according to what the blood is on that side of the heart, right? So when we go, thoop, 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 that first one, that's S1. Thoop, that's when blood's going up and hits the AV valves. So what's this one going to be called? It's got to be called S2. I made the heart a little bigger. What are those top chambers called? What are those bottom chambers called? What valve is on the right here? On the right, pulmonary. Pulmonary semilunar. So I heard semilunar. What valve is on the left right here? Aortic semilunar. Now, truthfully, y'all, they're not side by side. One's in front and one's behind. But I'm associating them with the side of the heart. Okay? So blood goes up, closes those, that's over there. Blood shoots out and opens these, no sound. They're shaped like this. Blood hits the middle, they just go boop, just pop right open until the ventricle relaxes and the blood falls back against them and it does this. It takes those little cups and pushes them in the center, fills them up and they close. And that is enough to make a little sound. It's crazy, but it does it. So these close when blood pushes back onto them. Okay. Ventricles relax. Semilunar valves close. Why? Remind me why we have valves. Prevent backflow. See, we don't want the blood to go back up there. We don't want the blood to come back down here. So those valves are there to prevent that. So just before the blood could do that, it closes them. And the blood just keeps going in the right way. That's the whole purpose there. Yeah. What does SL stand for? Semilunar. What does AV stand for? Atrioventricular. So let me do the same thing over here. Let me go. I'm going to do this. Color code it better with the valves there. Oh, by the way, sometimes in medicine they call the pulmonary valve the pulmonic. So they'll say aortic and pulmonic, but they could just say pulmonary. Seemed like as time went on, more people just call it pulmonary instead of pulmonic. There's your normal heart sounds. That's it. Closing of the valves. The AV valves close first, the semilunars close second. Why? Because that's where we start the heart. We start the heart with the atria. So if we just start at the beginning spot and we follow through, we'll get this every time because you guys, it's going to become second nature. Atria contract and push blood down. Ventricles receive it. Ventricles contract, push it up and out. On the way up, it closes the valves. After it goes out, the ventricles relax. Blood comes back and shuts those valves. So notice, atria contract, no sound. Blood down, no sound. Ventricles contract, no sound. Blood up, finally a sound when it hits there. Blood shoots out, no sound. Ventricles relax, blood falls, second sound. So the sounds are heavily loaded toward the back side, not at the beginning of the heart. Okay. So notice truly, don't the ventricles kind of control the sound? Ventricles contract and that causes one sound to happen. They relax and that causes the other sound because the ventricles are impacting the blood movement. They're the real ones impacting the blood movement. So if you look here, we just did S1 and S2. And I've got it all there for you, just like you need it. Fancy terms, if a valve leaks or does not close properly, we could call it incompetent. I cannot imagine that showing up on the test, okay? I just want you to know terminology there. This one, more important, this word would be used most likely, regurgitation. Regurgitation simply means the backflow of blood. It's going the wrong way. The backflow of blood. So if we have a valve that is incompetent or leaky, we get backflow. If we go back to our picture here, oh, did I delete? There we go. What if blood here, what if that valve leaked and blood shooted up there? It would be turbulent. And what do we know about any turbulent flow? It makes a sound. And so, abnormal heart sounds are called what? Murmurs. Murmurs. So I'm going to show you two right now. We're not doing every murmur, just so you know. We're doing one type of murmur. A murmur due to, what's that short for? Which means backflow, right. So murmurs due to backflow here or here. Remind me, what makes the normal heart sound? the valve closing. So, ventricle contracts. Which way does blood go? Up. It hits that valve and closes it. That's S1. And now if that valve is broken, it leaks and it sounds like this. Thoop, whoosh, thoop, thoop, whoosh, thoop. Okay. So here's my question to you. And this is the way I phrase it on the test. When do you hear a murmur? Produced by regurgitation through one of these valves. So you're answering correct, but not how I want it, and that's okay. Because I want you to understand the concept, and then I want you to understand how physicians think of this and why the answer is what it is. So we would hear this murmur. If those valves leak, they can only leak after they already shut, right? After they closed. They close, they leak. The ventricle contracts, that closes them, and then they leak. So we hear this murmur, and this is how they say it. Isn't a murmur a sound? So what we're doing is we're comparing this sound to when were the normal sounds. That's how, when somebody says, oh, there's this murmur, when did it occur? They mean, according to your normal two sounds, where was it heard? So, you tell me, when would we hear a murmur if the AV valves, either one of them, leaked? So, ventricles contract, blood goes up, blood closes that valve. What's that called when the valve makes a noise? Sound 1, S1. So the answer is after S1. After S1. And that's what, so at first that's confusing. When these valves have murmurs, they're always heard after they closed. So that is after the first sound, after S1. And the reason they like to say, when did you hear it after S1, and why they don't say after the ventricle contracted or after, is because it's a sound and the other things were sound, and they're just comparing the sounds. So the idea would be, when I was in school, I had a whole cassette of heart sounds. And they had all these different heart sounds and all these different murmurs. And that made sense. You're listening for the sound. So when do you hear this abnormal one? Oh, it was after the first one. That's when it was. Okay. So this murmur on this side, regurgitation through the two AVs, either one, they would happen at the same time. They could both be leaky. And then it might be like, it would be weird. It would be, so, thoop, 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 thoop. They're right in there together. They're real close. So the point is, you hear it after. So it would sound like this. Thoop, whoosh, thoop, thoop, wish, thoop, thoop, wish, thoop. Close, leak, close. Close, leak, close. So you know what I'm going to ask you next. If these leak, when do you hear them? Close, leak. You got it. When the semilunar valves, the pulmonary or the aortic, when they leak, you have to hear them after S2 because they can only leak after they closed. So it'd be thoop, thoop, whoosh, thoop, thoop, whoosh, thoop, thoop, whoosh. If anybody does sonography, you're going to sonograph a lot of hearts. And when you do an echo, you can actually see it. They color code it and you see it going backwards and it flares. It looks so cool. But you can hear it too. See it and hear it in ultrasound. So what I'll do for you is I'll draw it again and make it simpler, because I just put it on the messy page. So you can take a picture of the messy one, but let's take all the normal stuff off there too, and then just do the leak. Nah, I want that. Okay. So this time, murmurs. Murmurs due to what's the fancy way to say that? So I will have a question like this. It will say, when do you hear a murmur due to regurgitation of the blank valve? That's how it'll be. So you know when you get a murmur, it's only going to be backflow. And all backflow happens after the valve closed because it's leaking. So it can only happen after. So we always hear them after. Here's why I make such a big deal out of this in A&P. When you go on one of the programs, you're going to learn that there's all other kinds of murmurs. And many other murmurs are not heard after. They're heard at other time periods. So they would say it totally different. So what I want you to have coming from A&P2 is a solid foundation of leaky murmurs, regurgitation, backflow, and to own the idea that when a valve leaks, its sound would be heard after it leaks. It's abnormal sound, it's murmur. So here's what we're going to do. If this time I'm just going to say the AVs leak. If the AVs leak, they leak when the ventricles contract and push blood up, and then it leaks after the valves close. So we hear it, and I guess I want to either AV. What were the two AVs called? Yeah, they were, but what were their fancy names? The 3-flap and the 2-flap. Tricuspid and mitral. So let me I'll put them here again, because I know the test question will use one of these names. It won't use that probably. The mitral valve, when it leaks, you hear it after S1. The tricuspid, when it leaks, you hear it after S1. This side is the tricuspid. This side is the mitral. But they're both AVs. And this one is so hard because you're still just getting used to where the valves are and what their full names are, and the fact that they're abbreviated names and group names too. So it's definitely not simple. Do you want a picture with that side done and the other side not done? If you do, to look at one at a time, you can do that. If not, you can wait till the end. When the semilunars, that's what these are, semilunars, when they leak when the ventricle's relaxed. And when they leak, these close first, and then they leak in the backwards direction. So blood goes down into those chambers. And so these would be heard after the normal second sound, or after S2. And yes, these are called the pulmonary valve and aortic valve. So it's not much cleaner, but it's a little cleaner, and it's primarily focused on the abnormal sounds or the murmurs now. We like to use murmurs just to see if you understand the heart sounds, to be honest, because it's an easy way to get it. Okay, last topic. The last topic is an ECG. I almost never say it right the first time because when I learned it, it was called an EKG. Had a different name back in the day. Here is a picture, not the greatest picture, it sure is pretty. It's not truly correct in how most of them look, but it's good enough. It's got the base pattern for us to learn from. So first thing about EKGs. We're going to take a couple of pictures of this before I mark it up for the final. The first thing is they are measuring something that's very important. They are measuring the electrical activity of the heart. So this representation, or this graph, is a graph of the electrical activity of the heart. Okay. So they changed the spelling, K for cardia. That was the old German spelling. Now they use the English spelling with the C. That's all. Same thing. So what do they hook people up. They put little pads on you, different places. And believe it or not, the electricity that's going through the heart sends a signal through your body, and it can be detected on your skin. Pretty amazing. Now, we know the body's electrical. We know the nervous system controls a lot. But what you may not know, which is fascinating, the heart can completely work without nerves. If you cut every nerve right now that goes to your heart would keep on beating because the heart generates its own impulse. Wow, how cool is that? And when you do the lectures, if you've already done the lectures, you heard of the conduction system, and the lectures are going to go in and talk about how that happens. But the concept is the heart generates its own impulse. It produces this, and this electrical activity spreads through the heart. And that's what makes the heart contract or relax, okay? It's this electrical activity that will tell First, the atria to contract. Atria to contract. Atria relax. Ventricles contract. Ventricles relax. That's our pattern. Atria contract and push blood down. What I didn't say most of the time is now the atria relax. Okay. Ventricles started off relaxed. They contract and push blood up and out, and then they relax. So what we're going to have here when we go through all of this and when we get it right is we're going to know that these are the signals and they have names. So I'm going to name everything here. I'm going to give it a proper name. Okay. Then I'm going to tell you, oh, this is the electrical signal that's causing that. The electrical signal has a name too. So I'm going to give you the name for the electrical signal. So we're going to name the graph, we're going to name the signal, and then we're going to say, what does the heart do because of that? They either contract or relax some of the chambers. So that is like your flow chart. Take sure of that. Okay. And then I'll clean that out so we can clean it up a bit and we can focus on learning the concepts. Somebody's being monitored on a heart monitor, and that's all you see, that means no heart activity, right? They call that flatline, all right? Back in the day, they made a movie called Flatliners. It was about somebody coming back from surgery or something like that. If that happens, there's no activity of the heart. So I want you to understand, however little it is, it's still something. It's enough to keep us alive. This is activity. This is activity. Definitely bigger than this. And this is activity. This is where they messed up. Oh, this one should be bigger and tail off like that. But it doesn't matter. That's not important for us. What's important for us is that we see the 3 locations that happen. Okay. Remind me what the name of this thing is? Yeah. So that is an electrocardiograph. Okay. The machine is an electrocardiograph. And you won't have to write that. Now that you've written it down, you won't have to write that. I might say it, most likely I'll abbreviate this for you. Right here, when it leaves the flat line and moves, they call those things a deflection. And what we're going to do is we're going to name each of the major deflections. You can see what they did right here is they named them A, B, and C, right? But here's the funny thing. They don't name them that. They don't name them 1, 2, and 3. And in fact, there's not just 3 of them. It starts right here, and they decided that this one here at the peak, we're going to call it P. And the way that it works on this is every time it peaks, we rename it. So watch this. If this peak is P, then this peak is, you want to help? So they just started with P and they named them P, Q, R, S, T. And I don't know about you, but somebody looked at this long ago and said P and T, they look like a little ripple or a wave. So they named P the P wave and T the T wave. And QRS is a little crazy, so they called it a complex, the QRS complex. your first level of knowledge is to name deflection A, B, or C. A is the P wave, B is the QRS complex, and C is the T wave. There will be a question on the test that will ask that, probably of one of those. Okay? So that's your first level. Just name it. Okay, what is the name of deflection A? What is the name of deflection B? What is the name of deflection C? So notice how I put name of deflection. Okay. The second part of this is that A, that is an electrical, and by the way, I abbreviate electrical like that. That is an electrical signal. So I am going to ask you about that electrical signal at A. And the phrase will be different. It won't say name the deflection. So here's what I want to remind you from how we started. There is going to be an electrical signal that controls the muscle contracting. There's going to be a different signal that tells it to relax. So there's two signals. There's a contracting signal and a relaxing signal. Okay? Maybe in AMP1 you learned these names, but maybe you didn't. I'm going to write them up there, but I know I need that room later, so I'm going to erase them. So if you choose to write this next thing down, write it like way off on the top corner. Okay? You remember that word? Depolarization? It depends who you had for class and how much they talked about stuff. I know Dr. Day goes into it. Okay. Here's what depolarization is. It is the electrical signal that leads to contraction. It's that simple. It is the electrical signal that leads to contraction. The other electrical signal is called, remember, I'm going to erase this because I'm going to need this room. It's called repolarization. Anybody want to try to help me out with what you think its definition might be? Look at the first one.
Leads to relaxation.
Perfect. Repolarization is the name of the electrical signal that leads to relaxation. Now, you may have learned this when you studied muscles. You may have learned this when you did action potentials. And if you learned it when you did action potentials, they didn't relate it back to the muscle necessarily. They probably related it to sodium and potassium, which we don't need to do right now. That is in the lecture a little bit, but it's really to help you understand calcium and the concept. The idea is depolarization are active signals and repolarization are kind of resting or relaxing or resetting or something like that. So the action comes from the D and the kind of relaxes it or retraces it or however you want to say it. And so I would suggest, just to have it in your notes, you take a picture of this. I'm going to go ahead and take depolarization and repolarization off of there because I need to be able to put it on. By the way, this is absolutely the hardest thing we do tonight. I save the best for last. So here's what I love about this. This is going to follow. Now here's the common sense part. This is going to follow what we've done all night. We start with the heart. Name these chambers. Atria. And what do they do first? Contract and push blood
Down.
That is the signal that tells the atria to contract. Okay? So, what are we going to call it? What are we going to call that signal that tells the atria to contract? Watch this, it's so cool. We're going to call it I'll let you write this down. I want it in the picture like this, though. What do you think that stands for? Atrial depolarization. Yeah, depolarization of the atria. That is depolarization of the atria. So I'll go A-T-R-I-A-L, D. A-T-R-I-A-L, atrial, or just the atria depolarized. You don't have to get the form perfect. The atria depolarized, or this is atrial depolarization. When I get to the T wave, I'll write them all out because I'll have more room. Okay? So you'll see it written out in longhand over there. So here's the cool thing. This happens, the atria depolarize, and that tells the atria to do what? Yes. So this right here, this is how it will be phrased. This is the mechanical activity. Big difference. Electrical, mechanical. Electrical signals cause the muscle to do something. The muscle doing what it does, that is mechanical. So I had to come up with a way, how could I let you guys know what I'm asking on the test? Because it needs to be clear. It doesn't need to be tricky, right? And the way that I came up with it, I'll either ask you about the electrical or the mechanical. If it's mechanical, it's got to be contract or relax. If it's electric, it's depolarized or repolarized. The tricky bit is every time it's associated with a chamber. So you just got to name the chamber with it. Okay? So let's go back and start fresh and new. We know the first thing that happens to the heart, these chambers, what are they? And what do they do? Very good. So the atria contract. So here's what I'm telling you. There's a signal that happened behind the scenes that spread through both atria that told them to contract. That signal was called atrial depolarization. A wave goes through the atria, and it does that, right? The SA node causes it to happen. You'll learn that in lecture. Goes through there, the atria contract. Then the signal goes to the ventricles, right? And it's going to do something to the ventricles. After these atria have contracted, though, what do you think they need to do next? They need to go back, right? They need to relax. So a signal follows that tells them to relax. Man, this signal looks giant, doesn't it? Which muscle's the biggest muscle? Atria or ventricles? Yeah. Just comparing. Little tiny, big, right? So look here. Little tiny, big. Ah. So here's the funny thing. The atria depolarize, and now the atria have to, oops, sorry, I want to use color I want the electrical to be blue, and I want the mechanical to be red, okay? Not for any reason, I'm just trying to make them stand out for you guys. So after the atria depolarize, what must the atria do now? But they have to repolarize, and when they repolarize, that tells them to relax. That tells them to relax. So this happens first, then this happens. Funny thing, at the same time as the atria are doing that, now it's time for the ventricles to contract. So all of this bigness, the atria were doing that, but at the same exact time, the ventricles were depolarizing and made boom, 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 boom. All this happened. So they blocked. We don't even see that. We know it happens here, but we don't see it. This we see. That's the big spike. But the atrial repolarization is still there. After the ventricles depolarize, now mechanically they can do what? What will the ventricles do because of this depolarization? They will contract. So back to the beauty of this. Atria contract. What must they do next? Relax. Ventricles contract. What must they do next? Relax. What is the name of the relaxing signal? Repolarization. What is the name of a contracting signal? Depolarization. What comes first, electrical or mechanical? Electrical first causes mechanical. Depolarization causes contraction. Repolarization causes relaxation. So let's go back through it again, because this really isn't bad. It's just so new. The beauty of it is we start right here every time, okay? Name the chambers. And they do what? And push blood down. We know that. There it is, step one. Just say they have to depolarize before they contract. When the electrical signal goes through the heart, it causes a little P wave, and the atria will depolarize. They are depolarizing, and now the atria can contract. And while they're in contraction, this is a cool thing, the signal's already rolling through them to repolarize them. And so right after that, they relax. And the signal now is already moving down to the ventricles. And the signal to the ventricles, well, they're already sleeping. Now it needs to activate them. So it's going to be a depolarizing signal to tell them to contract and push blood which way? And up and out, right? And so they depolarize, they contract, they push that blood up and out. And while they're in that state, the signal's rolling through them, already preparing them to do what? To relax. And what are we going to call this T wave, this signal that tells them to relax? Repolarization of the ventricles. And I'm okay if you say repolarization of the ventricles, depolarization of the atria, or you can say this way. And ventricular repolarization would lead to? Very good. Relaxation of the ventricles. So there's your last picture of that. I want to take you, there's a reason I made that PowerPoint review. I want to take you to it and show you the real, like, way the wording would be on the test. So you can see that you already know, you know the buzzwords, you know the formula for how the questions are going to come at you. Man, my phone hit low power mode. I must have used it a lot today. Oh yeah. I did training on my phone today. That's right, instead of my computer.